I'm here with Leesa Galloway, my mother, and she is a cancer survivor. So she's going to tell us a little bit about her story and what she's gone through the past year or so. So, Mom, when were you diagnosed with cancer?
Actually, it started last October. I started having trouble with my back, and I went to my family doctor. And it wasn't until February that I was actually diagnosed. And in the interim, I saw my family doctor, a chiropractor, a physical therapist, an oncologist, a neurologist, pain management specialist, and had lots of tests. Getting to the diagnosis was really practically 98% of the treatment. So it took from October to February to find out that I actually had cancer and where it was.
So, how did the doctors discover that you had Non-Hodgkins lymphoma?
I had lots and lots of tests, CTs, colonoscopy, mammogram, x-rays, blood work, and I had trouble with my back originally and trouble walking, which finally led them to do x-rays and MRIs, which revealed a tumor pressing against my spinal cord.
Wow, that's quite a process. When you finally received that diagnosis, what was your reaction? How did you feel?
Well, because I started out thinking I was having back trouble, I wasn't expecting anything more than maybe disc surgery. So finding out I had a cancer or a tumor, right away I knew I had to have major back surgery. And then there was also the anxiety of not knowing if the tumor was benign or cancerous.
So, once you found out the diagnosis and you had cancer, what next step was chemotherapy? What was it like going through chemotherapy? Were there any surprises?
It was sort of a double whammy for me because I had to recover from the major back surgery when they removed the tumor. So I was hospitalized for 21 days and in the spinal injury unit because the tumor had compressed my spinal cord for such a long time that I wasn't able to walk and had to relearn that. Then I had to wait. After they removed the tumor, they had to send it out to special labs, not only to diagnose that it was in fact cancerous, but also to determine what type of lymphoma it was, because there are many, many types of lymphoma. And they have to be very careful about diagnosing the specific type, because each type of cancer has a very specific treatment. So that was one of the hardest things, was waiting. Once they told me that the tumor was in fact cancerous, waiting to find out what kind of cancer, because at that point I didn't know if they would come back and say, oh, you have 2 weeks to live, or if they would say, oh, we think we can treat this.
Wow, that must have been really scary. What about, you did find out that you had non-Hodgkin's lymphoma and that it was treatable. So then you basically had to go through chemotherapy. How long did you have to go through chemotherapy, and what was it like?
I had 6 treatments and they were 21 days apart. Before I left the hospital, they did another surgery and implanted a port in my chest here. And that's to give direct access to your bloodstream. So I would go to the cancer center and they would hook up the chemo to my port, and I would sit there for several hours and they administer the chemo. when I would get back. Before that, I had to take massive doses of prednisone and other medications to control nausea and painkillers before the chemo to prepare for it. And then usually the first night after I would get it, I would have a really rough night. Then there would be a couple days grace period, and then about the third or fourth day I would have what I called crash day, and that would be when I'd feel the worst, and I would just lay on the couch and not be able to do anything. And it would take about another 5 or 6 days to start to feel decent again. So basically, I would get the chemo treatments and feel terrible, and about the time I started to feel good again, then I'd have to go back for another treatment and feel terrible all over again. And of course, there was always the side effect. Two people that my husband worked with had cancers. One man had colon cancer. He came and talked to me and gave me some suggestions or advice about what to expect. And another lady who had breast cancer, and she directed me to someone who could help me with my hair. They had told me that the chemo would cause it to come out, which seems silly, but it's kind of traumatic for a woman, and I've had long hair all my life, so it was really hard. It started to just come out in clumps. So I went to this specialist who makes wigs specifically for women who have cancer, and he shaved my head completely and fitted me with cranial prosthesis, they call it. And insurance actually covers it. So then I had hair again, so at least I felt like I looked normal, and that was a relief because I sure didn't feel very good.
Wow, that's so cool that they can make cancer patients at least feel like normal humans while they're going through that really hard process.
And I must add that the Cancer Society had a program called Look Good, Feel Better or something, and you could go for a session and they actually instructed you on wigs and hair care and makeup while you have cancer. You don't think about it, but even your eyelashes and your eyebrows come out. You lose all your hair. So they told us about using makeup, like to put fake eyebrows on, or if you wanted to use false eyelashes and that kind of thing.
That's really helpful. So yeah, I guess now you can say you've beat cancer. That's really awesome. How long have you been in remission now, and what do you most appreciate now that you're gaining strength and headed towards full recovery from this awful disease?
My cancer was an aggressive form of lymphoma, and it was in an unusual presentation, being that it was pressing against my spinal cord. So I was very fortunate that it was a treatable cancer, and they said the first 5 years is when you're most likely to have the cancer recur if it's going to come back, and especially the first year. So the first year I go to the oncologist every 3 months, and each time they do blood work and do a CT, and that's how they determine if my cancer's come back. So I'm actually just recently had my 9-month appointment, and I'm still clear. So when I go back this October, that will be the 1-year mark for me to have stayed clean from cancer. The port will remain until I hit the 5-year mark. After this first year, then I think you go back every 6 months up until 5 years, and then after that, maybe you go back annually, I think, for some time, and they remove the port, and then they feel that you're, at least for the time being, cured. But you never know. It's like living in a constant state of limbo, because you don't really know if it ever will come back or when. it makes you appreciate life very much and realize what's important. And I remember at the time I was diagnosed, one of my daughters was pregnant, and this would be our first grandchild. And I remember one of my first prayers was, Lord, please let me live to see my grandbaby, because I just really wanted to be around to see what my grandchild would be.
Well, that's such a wonderful story, and gosh, it must feel so powerful that you were able to see your grandbaby, and you babysit your grandbaby almost every other day now, don't you?
I do, and we had great support from our church and a lot of friends and family. So I was very fortunate that way too.
That's important. Well, that's so great, and thanks to organizations like LLS, research continues to be done on these types of cancers, and people like you are able to enjoy their lives cancer-free. So thank you so much for sharing your story, and congratulations on being a cancer survivor.
Thank you.